of complementary medicine and wondered what role it can play in the treatment of Crohn's disease or ulcerative colitis? Complementary medicine includes a variety of treatment options that are not considered conventional medicine. Complementary medicine can include things like mind-body therapies, supplements, probiotics, and medical cannabis. It's important to know that complementary medicine will not cure your disease, and it should not replace conventional therapies. And as always, you should speak with your healthcare provider before adding complementary treatments into your regimen. I'm excited to be joined tonight by Dr. Rajesh Shah, a gastroenterologist with Baylor, Scott & White Health, and IBD patient Kira Young. Dr. Shah and Kira, thank you for joining us tonight.
Thank you.
Thank you.
For about the next 30 minutes or so, Kira and Dr. Shah are going to answer your questions about complementary medicine and IBD. We want this to be interactive, so if you're watching along with us live, comment, let us know who you are and where you're from. A few important disclaimers before we get started. Tonight's chat is meant to be for informational purposes only. The views shared during tonight's chat do not represent the official position of the foundation. Always consult with your physician before making any changes to your IBD treatment regimen. And as usual, tonight's topic is complementary medicine and IBD. If you have questions about other topics related to IBD, we're not going to have time to get to them tonight, but our IBD Help Center is available if you want to reach out to them, and they can be reached at info@crohnscolitisfoundation.org or 888-MY-GUT-PAIN. And lastly, if you enjoyed tonight's program and the other live video chats we host, we hope you'll consider making a donation either right here on Facebook or by visiting our website at www.crohnscolitisfoundation.org so that we can keep bringing these types of programs to you in the future. With all that out of the way, let's jump right in. So Dr. Shah, I explained briefly before what complementary medicine is, but can you explain it a little bit more in depth about what it is and how it differs from conventional medicine?
Sure. And again, thank you for organizing this. I hope this will be a fun and interesting chat. As far as complementary medicine goes, it's considered by definition a non-mainstream practice that's used in conjunction with or alongside conventional medicine. So conventional medicine might be medications that we typically prescribe or things like that. And then complementary practices would be things like you described, mind-body therapies, probiotics, supplements, anything like that. So the two are used in conjunction with one another.
Is there a difference between complementary medicine and alternative medicine?
Yeah, so that's a good point. It's almost more of a definition question. So like I said, complementary medicine is all these kind of non-mainstream practices that are used with conventional medicine. Alternative medicines is almost kind of using the same thing or some other kind of therapies, but they're replacing conventional medicine. And in that sense, I would stress like that's not a good route to go. It's really we want to do complementary medicine in conjunction with conventional medicine.
Are there any complementary therapies available that help treat IBD?
Yeah, so that's a big question. So I think it comes down to what we're trying to say when we say treat IBD, because I think that can be an important part of this. So I think of it in two ways. There's treating inflammation, and then there's helping manage symptoms. And when we think of medications, we're really thinking in terms of both symptoms and inflammation. There's all kinds of different measures and whatnot we'll use to evaluate that. And then in symptoms, we're thinking about things like diarrhea, bleeding, perhaps abdominal pain, bloating, things like that. So whenever we're thinking of treatments, we have to kind of put it in that context. I think the other big piece of this is when we think of any therapy, we're thinking of the strength of the evidence, or how much do we believe this therapy works. And that can come to different ways of doing that, but our best type of studies or whatnot are called randomized controlled trials. And these are ones that we put our most faith in when we say this treatment works for this disease. And I would put all this in context of saying that many, many complementary therapies do not have really well-designed randomized controlled trials to look at them. So when we're thinking about treatment, we have to accept that, okay, well, there might be lower levels of evidence, or our confidence in this treatment might be less.
Thank you for that explanation. That was very helpful. So, Kira, I know you have experience incorporating some complementary medicine into your IBD treatment regimen. How did you first find out about complementary medicine, and why were you interested in trying it along with your IBD treatment?
Yeah, it's a great question. Thank you. So when I was first diagnosed, and this was about 10 years ago, I was in my mid 20s. My doctor, the conversation I had with my doctor was basically just outlining medications. And it really wasn't until I did not respond to the first one and then the second one that I really felt that I needed to take some of this, a little farther than that, because as a lot of people know, some of the medications can take time to kick in, and then you need time to evaluate. So that in my mind is a lot of time that I was, um, in a very bad flare, getting worse and worse and worse. So I kind of took it on myself first to do some research and say, is there anything else that I can be doing? And when I found a couple things I was interested in, diet and nutrition was the first thing that I really found that was more widely talked about. Back then, I brought it to my doctor, had a conversation of, hey, can I try this? What do you think? And that conversation was kind of interesting because his response is, there's no clinical evidence that this works. It's a lot of work. Most people don't see results here, but have at it. So at that point, I didn't have a lot to lose. Honestly, it was, that I could do this and maybe not have a result, or I could sit here and I don't know, maybe not have a result, just waiting for my medication. So I felt more comfortable doing some experiments. It was very difficult. I did some elimination dieting and, just trying to figure out what trigger foods were. And it's very difficult to stick to, but I did it and I saw success once I did find a few things that I could pull out of my diet. And from there, it's like, yes, I'm all in here. I'm going to try and figure out any other little things, any levers that I can pull to help my symptoms or side effects of medication and those things. So that really sparked my interest of a whole rabbit hole of other side therapies that I've been on the last 10 years.
Thanks for sharing that, Kira. Dr. Shah, are there any specific complementary therapies you suggest for your patients, or what about advise against in their care?
Yeah, so I like that story that you brought up, because I think that kind of comes to the heart of it is it kind of depends on the goals that the patient's trying to accomplish. And then it's kind of tailoring the treatment to kind of fit that. And like you've mentioned before, we've said before, we'll go into more detail. There are mind-body type therapies, there's diet, there's supplements. So it's really a conversation between me and my patient of, okay, well, what are we trying to accomplish? And now how can we integrate some of these things in to maybe kind of accomplish that goal?
Okay. So, Kira, how did you go about sharing your interest in complementary medicine with your doctor? And Dr. Shah, do you have any tips for patients who want to bring it up with their provider? Kira, let's start with you.
Yeah, perfect. So, my initial conversation with my first doctor, it was like, hey, go for it, basically. After that, I had switched doctors in the same practice, and the doctor that I saw after that, he brought up a couple of things with me because I said I was interested. So what actually happened with that doctor, we developed a really great relationship where anytime I'd read something of, am I strong enough for exercise? Can I try something? Or what about meditation and stress? We would have really great conversations. And there were some things that he would get really excited about and some things that he was very honest with me and say, no, I don't think that's really going to do much for you. So that for me, I felt very comfortable talking to my provider about trying these things and having him on board with anything that I was trying, because he was trying to figure out a lot of it too, because I kept failing on every medication there was. So it was really just getting me through, just getting through. So that open communication and feeling comfortable with my doctor was huge for making me feel comfortable about incorporating these things into my day-to-day practices.
That's so important. I think being able to have that trusted and open relationship with your physician is incredibly important in your IBD journey. So I'm glad to hear that you do have that now.
Yes.
Dr. Shah, what advice do you have for patients?
I think the main thing is just kind of bringing up the topic. I mean, physicians can sometimes get in a path of just trying medical therapy after medical therapy after medical therapy, and not necessarily think of incorporating these in. And honestly, mostly in my practice, a lot of times patients will sometimes bring it up before I even get to it. And that's what I'd encourage them to do is if you're interested in a topic, if you've been reading about it, talk to your physician. Unfortunately, sometimes you may run into a doctor that isn't as brushed up on it, or for whatever reason hasn't really explored these topics. In which case, either you work with that physician and try to figure out how can we integrate these in. But I think the main thing is just bringing up that you're interested, starting that conversation, and then hopefully having a productive conversation with your doctor.
Great. So let's talk about some specific complementary therapies. Dr. Shah, can you explain what probiotics are, and are they best taken as supplements or in foods?
Sure. So probiotics are basically live microorganisms, mainly bacteria, that people then consume with the idea being there will be some health benefit from this. And in terms of probiotics, bacteria, we've learned a lot over the years. I mean, we think back years and years, we used to think all bacteria were germs and they were all bad. But then we came to realize, okay, no, we have many, many bacteria in our intestines, and they do good things. They help us with digestion, help produce vitamins that we need, things like that. So we've kind of come around to say, okay, well, no, this is a good thing. And in terms of how people might take them, I usually end up recommending again, it's a discussion with the patient, but I find patients really do well with yogurts, sometimes supplements. I caution one thing with probiotics in that our understanding of these is still pretty rudimentary. There are kind of two big groups of probiotics. There's one group, lactobacillus, and another called bifidobacterium. But within these groups, there are many, many, many different types of bacteria. And our understanding of what these actually do in the intestines is still evolving, let's say. So I have patients try these probiotics. I have them try maybe one for 2-3 months, see how they feel with it. If they haven't really noticed much benefit in whatever goal we're trying to accomplish, well, then we talk about, well, do we try something else, or do we try a different therapy entirely?
Okay. Are there any specific vitamins and or minerals that can help IBD patients?
Yeah, so there's 3 main kind of, let's say, vitamins, minerals that we as physicians commonly think of. That would be iron, vitamin D, and vitamin B12. And these are ones that physicians are pretty comfortable with. We'll check these concentrations in the blood, and if we need to, we can correct them. In terms of other supplements, there are a lot of different ones out there. I think the 2 that have maybe better bases of evidence, we'll say, are fish oil and turmeric. So fish oil, obviously you can imagine, comes from fish, certain fish, such as salmon, mackerel, things like that. Or you can obviously get them in like a capsule supplement. There's been some basic science studies, so things in like mice, that have shown, well, this may help with inflammation. Unfortunately, some of the larger human studies didn't really seem to show it worked all that well. That said, there have been small studies that suggest that it works, and the downside's pretty minimal. The main side effect is it can kind of smell like fish, or your breath might smell like fish. So whether people like that or not, it's probably their main side effect there. The other one is turmeric. So this is a root found in the ginger family. It's used a lot in Asian cooking. Again, basic science studies, mouse studies have shown it does seem to do something to inflammation. In human studies, it's actually a little bit more promising than, let's say, fish oil. In patients with mild to moderate ulcerative colitis, there may be a role for curcumin, which is kind of one of the active ingredients in turmeric, for helping induce remission as well as maintain remission when used with mesalamine. And I would stress that part. And these are patients with mild disease. So there may be a role for that one.
Okay. So my next two questions are on probably the hottest topics within kind of the complementary world. And the first would be diet. Is diet considered a complementary therapy? Why or why not?
Well, I think short answer is probably yes. I think it is a complementary therapy, but I think it's a whole lot more than even just that. I mean, diet is one of the foundation pieces of just health in general. And there's been a lot of different diets that have kind of been explored, studied, and are ongoing studies for patients with ulcerative colitis and Crohn's disease. There's things like carbohydrate exclusion diets, the Mediterranean diet, low FODMAP diet, gluten-free diet. There's a lot of different ones that have been studied, looked at, and are being looked at. I think the main thing I stress with any patients that are thinking of exploring one of these diets is one, again, we're trying to fit it into the context of what are we trying to accomplish? What's our goal we're using a diet for? The other thing I always stress is talk with your physician about it before doing it, because I've seen patients where they start trying to remove things from their diet and they remove so many things, they're impairing their own nutrition. So definitely talk with your physician, maybe even work with a registered dietitian. I certainly encourage that to really tailor a good diet that's still nutritious. And another plug I would throw in there, the foundation has great resources on their website regarding diet, and it's worth reviewing those resources too.
Well, thank you for mentioning that. And we will post links to all of the resources on the topics that we're discussing in the comment section after the chat is over so that you all have access to those resources afterwards. All right, so for the next hot topic, what are your thoughts on medical cannabis? And is there any evidence showing that it can be helpful for patients?
Yeah, so this is a hot topic, not just in patients with inflammatory bowel disease, but in a lot of conditions. And I think with medical cannabis, we have to keep in mind that cannabis has many, many, many different active compounds in it. So the ones that have been the most studied are THC and CBD. So THC is kind of known for its effects on mental state, you could say. And then CBD is the compound that's thought to have maybe some more immunomodulating properties, let's say. In terms of patients with inflammatory bowel disease, again, if we come back to this kind of paradigm where we're trying to treat symptoms or inflammation, there really isn't any strong evidence showing that cannabis will help treat with inflammation. And I would stress that point. So as far as inflammation goes, we don't have any strong evidence for that. There are some small studies that suggest that taking cannabis may help with other symptoms. These might be things like anorexia, kind of a poor appetite, abdominal pain, things like that. So there could be a role for it, but I think this always has to be balanced against the potential risks of cannabis. There are kind of theoretical risks of increased risk of abuse or addiction to it. Obviously, the mental status impairment it could have. And then there is a rare syndrome where people that use it chronically can develop recurrent nausea and vomiting. So that's certainly something most people want to avoid.
And of course, there's also the legal implications and any potential work issues and things like that. So if you're considering medical cannabis, make sure you are well educated, you work with your doctor, you learn as much as you can to understand all the issues related to it. Sakira, we did not forget about you. Which complementary therapies have you tried, and which did you find helpful, which didn't help as much?
Yeah, so I said before, I started with diet and nutrition first, and when I did find a few things when I was flaring that helped, when I eliminated them, that helped my symptoms. I just as Dr. Shah was mentioning, I started to shift my focus on nutrition because I did learn over time that a lot of the side effects and things that I was feeling, I was weak, I was malnutrition, like shifting the focus from food that caused symptoms or triggered symptoms to making sure that my body had the proteins and the nutrients it needed to help me fight off and heal was a really big shift for me over time. So it did over. This is over a course of a very long time, probably like 6 or 7 years. That I kind of evolved my diet, which now I'm currently in remission, and my diet is very different than what I would do if I were to flare. So understanding that there is different nutritional needs for myself for when I flare versus when I'm in a healthy state, and focusing on nutrition, huge for me. Um, Once my doctor cleared me for exercise, he actually recommended that I try some yoga just for, strength, mind, body, just go give it a try. It's funny, I never was a yoga person. I wanted to run or spin or, something upbeat. And once I did yoga the first time, I was so hooked, and it opened this crazy door to a whole bunch of different mind body therapies that I never thought that I would be into, but it led me into meditation practice. And that, I think, was when I really started seeing big changes in my health. Was when I was really focusing on the mind body connection, listening to my body and trying to figure out what it needed, resting when I needed rest. That's something, it sounds so simple, but when I was working in a fast-paced office, I worked in advertising at the time, and it was just go, go, go. That rest wasn't really something that we did. And learning to just, again, so simple, just learning to do that and listen to my body when I needed it, huge. I saw huge improvements. So those, going that route was the biggest for me. I had a lot of supplements, I put probiotics, all that, but I did notice that once I had an established mind body meditation, yoga practice as a baseline, I didn't need any of that quite as much. So that is where I really saw things turn. I've also, through that, gone and done acupuncture. Again, when I'm flaring, that's something that I like to do regularly. When I'm healthy, I tend to let that fall off a little bit, but it helps me a lot to navigate pain, specifically in nausea. And I've done some hypnosis, and then I actually ended up getting a Reiki certification to help with arthritis and pain management, which thank goodness I did right before all of the quarantine stuff, because I can't go to acupuncture and things. So that actually worked out really well, that I can just do that at home. And that helps me really feel my best. So yeah, it's like I said, whole yoga just opened the door to a whole different world, and that really helped me a lot.
Well, that's great. I'm glad you were able to find some things that help you manage your disease and these symptoms that can, really impact your day-to-day living that may not necessarily be managed as well with traditional medicine. So I'm glad that you found things that coupled together are really working for you. I realize we didn't talk about this before, but Dr. Shah, can you just explain quickly for those who are unfamiliar what mind-body therapies are and how they might help IBD patients?
Sure. So we kind of touched on some of those now. So things like yoga, meditation, acupuncture. I'd put exercise in that category too. And again, they're kind of complementary therapies. They work well with conventional therapies. Some of them obviously have better and more evidence than other ones. Acupuncture is an interesting one that it's been shown to help with pain, nausea. There's even some evidence that suggests it could help with inflammation. Exercise, I think, again, it's good for everything. Mainly it's in moderation. There's been some scientific studies trying to look at exercise, but it starts getting kind of parsing things a lot. Is it vigorous exercise, moderate exercise? But I think if you're exercising and you're not completely exhausting yourself regularly, that's pretty good too. Meditation, yoga, things that can kind of focus the mind a little bit and kind of, you said, kind of center things. Another good thing, again, I can't necessarily recommend it from scientific studies to say it helps with this, and this, but I think it does help with symptoms.
Great. So I know a lot of patients have heard of fecal matter transplant, or FMT. Is it safe to do, and can it be used in IBD?
Yeah, so FMT, or fecal microbial transplants, has been a hot topic lately. So it's actually a really ancient practice, but basically you're taking healthy donor stool from somebody who presumably does not have any intestinal diseases or anything, and you transplant it into another patient, let's say someone with inflammatory bowel disease. This can be done in a couple of different ways. It could be done by an upper endoscopy, could be done through a colonoscopy, maybe even enemas, and there's some ways of trying to do this through pills. But in the end, you're getting that donor stool in, and the idea is, okay, it will change the bacteria in your intestines and kind of reset things in a way. There's really good evidence for this therapy in an intestinal infection called C. difficile. It's a recommended treatment now for kind of recurrent C. difficile infections, and wonderful evidence there for that. In terms of IBD, there's been multiple studies that have looked at this, and there's pretty conflicting evidence for it. At least at this time, it's really should only be done in the context of a research study, in my opinion. There's not real strong evidence for it now. We're still kind of learning how should we do this in terms of what is healthy donor stool, what bacteria are in there, how should this be processed and handled, what's the best way to conduct this transplant? Is it a colonoscopy? Is it an enema? And do we do it only once, or do we do it repeatedly? A lot of the studies that have looked at this have been, say, enemas, and they're done repeatedly over the course of weeks. So there's a lot still to learn about this, and I really think it belongs still in kind of the clinical research realm.
That's really helpful information to know. I know that there were a lot of articles within the last year of people trying to do self-FMT, which don't do it, not a good idea. Leave it to the doctors. We need more research. I think that's the most important part. So before we wrap up, I just wanted to see for both of you, Kira and Dr. Shah, do you have any advice for patients who are interested in trying a complementary therapy, or any last words you want to share about this? And Kira, we can start with you.
Yeah, my recommendations would be that if there's anything out there that sounds interesting, to bring it up with your doctor and have a conversation. I know at first, before I was well established with my doctor and felt comfortable talking to him, it was kind of scary at first asking a doctor. They know so much. They're the experts. But once I did remember that I am the expert of myself. And if there's something that sounds like it could, even if it's to help anxiety around a visit to the doctor, for example, that it's worth considering and having a conversation about. So to always feel like you can ask questions, and and the worst that'll happen is they tell you no, and you can ask them why they don't think that, and most of the time they'll give you a good reason. So always and trust yourself. Again, if something seems like it could help you, just experiment and try it. Most of the time it can't hurt, except for the self FMT that.
Dr. Shah, any last things you want to share, advice you have?
No, I mean, I would echo a lot of that. I think that the main thing is just bring it up with your doctor. I do recommend engaging them in that conversation if you want to do something, because you want to make sure it's not going to do something that's going to interact with other things. And like we started at the beginning, I would certainly use these in conjunction with taking conventional medicine. I've had a few cases where patients really just want to try something else, and it causes more problems down the road. So really, this is something to use with conventional medicine. Really involve your doctor in that conversation. And again, review good resources, really educate yourself on them. The foundation has great resources. So that way it's a very productive conversation, and you can kind of challenge the doctor on, well, if you're saying no, why?
Great. Well, thank you for joining us for tonight's Complementary Medicine and IBD video chat. Dr. Shah, Kira, thank you both so much for taking the time to chat with us today and for your commitment to the IBD community. Any last words you want to comment before we end the chat?
Nope. Thank you so much for having me.
Thank you.
Great. Well, if your question wasn't answered tonight, please contact the IBD Help Center at info@crohnscolitisfoundation.org, or 888-694-8872. And we'll be live again next week on August 4th at 8 p.m. to discuss pelvic pain and IBD. And you can watch live right here on our Facebook page again.